Palliative care is the medical specialty that addresses the pain, stress, and other symptoms of a serious illness. Most hospitals in the United States have palliative care teams at this point, really over 80%. My name is Dr. Diane Meyer. I direct the Center to Advance Palliative Care, and I'm very pleased to introduce you today to a real palliative care team at work.
Palliative care usually begins in the hospital when someone is diagnosed with a serious illness. Dr. Andrew Esch is head of the palliative care team at Lee Memorial Health System.
Really what we try to explain to people is that our role takes on many different forms. The main goal is to help the patient sort of navigate through a very confusing and sometimes intimidating experience when they have a serious illness.
Palliative care teams are interdisciplinary in that we have physicians, nurse practitioners and nurses, social workers. We also will pull in whatever that patient and family need.
In palliative medicine, the partnership, it becomes a unit. The patient, the family, the caregiver, the other doctors, because we all try to help the patient and family achieve the goals that they've set for the patient.
The palliative care team works in partnership with the patient's other doctors. Dr. Daniel Delatore's specialty is internal medicine. He refers many of his patients in the hospital to the palliative care team.
I'm involved with palliative care on a day-to-day basis. Almost every patient I have in the hospital has some type of chronic condition that requires to some degree palliative care. It's very easy for a doctor to come in and deal with just a single issue without looking at the whole patient.
Hey Carolyn, how are you?
I'm doing just fine, thank you.
One of the things I value most about the palliative care service, they come in and they take a look at the broader picture, and they can sit down, they can talk to the patient, and they can wrap it up into a more holistic view that the patient is able to understand.
We do three major things. We do a lot of pain and symptom management, and those symptoms can be lack of sleep, nausea, constipation. Symptoms take on many forms in patients with serious illness. How's your pain been?
A lot better.
So that's a huge component of what we do is pain and symptom management. The second part of what we do is communication with our patients and their families. Also listening. Part of communication is not just talking to our patients, but listening to them as well, hearing what their concerns and questions are and getting those addressed. And then the third part is really supporting our patients through the process of their illness and in many cases beyond. Hi Joyce, how are you?
Hi, Dr. Esch.
Thanks for coming in.
Thank you.
Thank you.
Meet Joyce Jann. Joyce is learning to live with a serious illness, and Dr. Esch and the palliative care team are helping her.
In 2005, I was diagnosed with a 1 in a million very rare cancer.
When we approach a patient like Joyce who has complex pain and symptom issues, we try to be mindful that we know that there's multiple things going on, but really try to prioritize what do we need to do first.
Well, I had been on a very effective pain medication, and it was taken off of the market. And we did come down to the point that there was nothing prescription-wise that would be available for me. So I did end up taking a strong medication over the counter.
We weren't going to be able to talk about any of the other sort of social issues, financial issues, other things that probably were going on. People aren't going to be thinking clearly or wanting to talk about that if they're sitting in your office in pain. Well, I wanted to thank everyone for coming in today.
Palliative care involves the family as well as the patient. Today, Joyce and her family are meeting with the team for the first time.
One of the things that I think is important to address is families' questions and concerns and making sure we're all on the same page moving forward.
Joyce's daughters have felt frustration about their mother not asking for their assistance.
We've wanted to be there for her, and we've tried. I mean, whether it's making a pot of chicken noodle soup, bringing it over, or just sitting there. But I've never felt that we've done enough for her.
And I've discussed that with Dr. Esch, that has been my problem. I love to give help, I love to help people, but asking for help is difficult.
Palliative care has given Joyce and her family a better quality of life.
They come over here and they immediately line up for lunch. I love feeding. I love doing that. They love muffins, cookies, baking. You need to lose all of your fears of dealing with it alone, and you need to seek out palliative care, because I don't know of anyone that can do this alone. We all need help, a compassionate, caring group of people who are trained in getting you through this gently and lovingly.
If you or a loved one is facing serious illness, speak to your doctor and ask for palliative care. To learn more, go to getpalliativecare.org.